All right, Sonnies, this next segment is super close to my heart, and I mean literally because it involves my baby bird. Some of you know my sweet birdie recently went through some crazy ear situation in which I was been talking about on the show, and I have some incredible people over at CareVet of Ancient City that helped us through such a difficult time. You remember when Birdie was going through all this craziness. So I want to introduce my vet today, which is Dr. Grove, and her vet ninja, Holly, is in studio. Guys, welcome to the show. What's on your heart? What's new? How you been?
Hi, good. All good. Thank you so much for having us.
Well, you guys saved my guts last month. I mean, you're probably just rolling your eyes. It's like, oh, it's just a hematoma, but that was crazy. But you literally guided me through a storm, and I wanted to invite you to studio to thank you personally, because as you know, pet care is just a wild journey. And I want to talk about your wild journey today. Dr. Grove, how did you get involved with so many animals in your life?
So kind of old adage of I've wanted to be a vet since before I can remember. I actually have a piece of paper from 1989. Okay. 6 years old. That says I want to be an animal doctor.
Yeah.
So it's one of those things I've always wanted to be a vet. I've always had animals as a big part of my life. And along the way, there's been instances that have just reinforced that decision for me. So it's been a big part of my life, pretty much my whole life.
Yeah. Any specific animals that you grew up with?
I'm a horse person.
Okay. Yeah. That's a whole nother conversation, right? The equine community. Yeah. Yes. Very cool. And Holly, what about you? What about your journey?
So my career was in business.
Okay.
Business management, and, burnout happened.
Mm-hmm.
So I kind of just fell into a job at the vet clinic. Thought it was going to be a holdover job, and ended up loving it. So now I can't see myself doing anything else.
That's amazing. So, Dr. Grove, how long have you been in CareVet practice?
CareVet, I've been with them in my current role since December 2024. And for a year prior to that, I was doing relief for them.
Awesome. Very cool. So what does a day-to-day look like at your practice? I mean, do you guys see, I know it's got to be a circus,
different,
right? It's got to be a circus, right?
Yeah, every day. There is no typical day in vet med, right? Like some days are very structured and organized, and other days it's a 3-ring circus run by a ferret on meth, right? That just chugged some Red Bulls.
Right.
And you get to the end of the day and you're just like, okay, we survived that. I think most people know that a big part of the job is the clinical aspect, right? Seeing patients, appointments, surgical procedures, viewing blood work, calling clients, those types of things. What a lot of folks don't see is all the admin and the personnel management that happens behind the scenes. That's a big part of the day-to-day.
Yeah, I would say for my job, what a lot of people don't see is that the vet nurses, all the things that we do. So we are room nurses, we are surgery nurses, we are radiology nurses, we are phlebotomy therapists.
Absolutely.
So I don't think people see, back of the house kind of things. They just see the things that they see in the room. So there's a lot more involved, and it's organized chaos most days.
Well, it's not an easy thing because you're dealing with animals that obviously don't speak, and we're relying on you to be able to be the voices of our pets and what's going on with them, even in a moment of trauma. You have to kind of define the situation, but keep your cool and keep everybody like, it's gonna be okay. We're gonna get through this together and figure it out. So what makes CareVet such an extraordinary practice within the Ancient City? What separates you from other practices out there?
I would say, we're a very small team. So when you come into the clinic, you're always going to get the same people. Like a boutique kind of clinic.
Cool, good.
We're very community oriented. I run into people at Publix on the daily, or at the amphitheater, at a concert, and I love that. So I love that we have that connection with the community, and they're not afraid to come up to us and talk to us in Publix.
Absolutely, yeah. And have our questions, and can they have a little piece of rotisserie chicken?
Yes,
can they not?
Well, we want people to be comfortable the same way that you were when we went through this incident with Birdie, right?
Yeah.
You call us, we immediately like, yeah, come on down. Doesn't matter if we've got a slot available. We're going to make room for you. You know us. We know you. We know Birdie.
Right.
We know that even though hematomas are something we deal with on a daily basis, it may not be something that you're accustomed to, and that's your baby, and it's very stressful for you.
Yeah.
And a big part of our job is acknowledging the emotional baggage that comes with that,
Right.
and reassuring you that we're going to take care of this and she's going to be okay.
And that's got to be rewarding, building long-term relationships like that. I think that's such an important key factor within maintaining your practice and really and connecting with the community. I got to say thank you to you too, Holly, because there was a day where Birdie had to go to daycare at CareVet, and you met me early in the morning at 7:30 to make sure we got them there, and then I could be on the studio on time. That's that above and beyond customer service that I think is just missing in a lot of practices today. I think that's extraordinary, right?
Absolutely.
And it's something we think is really important because you're right. For a host of reasons, that's challenging to do in a number of industries, and particularly in veterinary medicine. But because of our smaller size, because of the bespoke model that our company allows, we can cater to clients that way. And it is extremely rewarding. It's a big part of what we consider the vision for our clinic.
Now, let me ask you ladies a question. So I love animals, and first of all, I think my husband was born to be a vet. Like every animal like gravitates toward him. It could be the most aggressive animal and they gravitate towards him. And
So calm, cool, and collected.
yeah. So how do you deal with, and is it something like a psychologist where you learn how to compartmentalize over the years? Like when it comes time to help that owner take their dog across the Rainbow Bridge or their cat or their ferret,
True.
how do you handle that, or does it still get to you?
I would say, I mean, there are times that, it still gets
It's
to us.
emotional.
There are
Yeah.
times that, I mean, we try not to break down in the room with the client,
True, yeah.
but it happens. I mean, you grow that bond with them and with their pet. I mean, those pets are our pets.
Yeah.
So, we try to compartmentalize the best we can, but there are times that it breaks us down a little bit, I'd say.
I mean, it's emotionally challenging, but by the same token, experiencing that spectrum of emotions is part of the human experience. I don't know that all veterinarians perceive it this way, but having had some people in my life that I've watched suffer at the end, I consider our ability to end suffering in veterinary medicine to be a privilege, and to be able to sit with owners in that discomfort in that moment. I see it as a great privilege. So it's tough if you have them stacked on top of each other because of the emotional burden that comes with that. But I view it as a privilege, something we can do in our industry.
And one of the things I think also that separates you from the rest of the game is you have a really good network in case you do get stumped. I mean, yes, I think you're the biggest smarty pants on the face of the earth, but when you do get stumped in veterinary practice, CareVet has an incredible network to be able to ask questions or get a second opinion. Can you talk about how extraordinary that is?
I'm a big proponent of phone a friend.
Yeah.
Right? It takes a village across the board. And as knowledgeable as one individual can be, there are going to be people that have other information. And we are very fortunate in this area that we have access to all sorts of specialists, very educated people, top of their field. And I'm very fortunate that they will let me text them and call them at random in the middle of the day.
True. Yeah, absolutely.
And I think it's been an asset, not only to the business, but I learn so much every day. I think if the day goes by that I don't learn something new, I wasted the day.
Right.
So I love being able to reach out to colleagues and network.
And you wouldn't be so passionate about this either if you didn't want to learn and absorb the information too. I think that's a super important thing to drive home. Okay, so I know you probably have some crazy vet stories. We got to dive into a little bit. Do you have anything like that you can share with us that maybe you had to go through something crazy and you saw the outcome?
We'll let you first on that one. You go first on that one.
We did confirm I can discuss this. I mean, there's plenty of crazy stories.
Of course.
One of the ones that really makes me chuckle. So before I came to CareVet in this role, I worked mostly relief. So that means I would go to various practices all over the state and cover for them. And I worked at an urgent care practice that we'd see a variety of, simple stuff like ear issues, but also ranges to significant emergencies. So I have a young Pibbly type doggo, a young version of Birdie, comes in very sedate, kind of got like the squinty eye, grin going on, heart rate's a little low, body temp's a little low. Humans, kind of the same, maybe a little bit more giggly and interactive. one of the things we always tell our clients when we deal with a potential toxicity or exposure is there's no judgment. Like I don't care what you have.
It's
in
not
your
good. Yeah,
home.
it's not gonna be helpful.
I need to know so that I can help your
Right,
I'm not
yeah.
calling the DEA. I'm not calling the POPO. I just need to know how to
Right, right.
So these owners were actually very transparent. They're like, we're high now.
Huh?
Of course there's weed in the house, but the dog never gets in. Like,
Oh
15 minutes we're
no.
going through. The dog never gets into it. The dog never gets into it. Finally,
Well, the dog got into it.
the dude's like, well, I mean, he kind of enjoys the roach. Now, as somebody, I'm not a marijuana person, so I'm like, I don't know what that is. My tech starts laughing. And I'm like, what is the roach? She's like, it's kind of like the end of it. And I'm like, there's still THC.
Right, yeah,
So these
yeah.
two look at each other and they bust out laughing, fall on, and they're like, the dog is high.
Oh my God.
Oh my gosh.
They thought it was hysterical.
Right, this poor animal. So, like, was
I can't.
there the dog wasn't panicked? Obviously, was super chill, is what you said, right? How do you get out of a situation like this?
So it depends upon the severity, and I would say definitely always seek care for your pet if you're concerned that they got into an illicit substance.
Mhm.
In this particular case, the signs were very mild, so monitoring at home was sufficient, but sometimes depending upon the dose ingested, you do need significant intervention. So this dude was very, very mild exposure. He was very stable, so he was able to go home with his owners. and just
Well, thank
chill
God.
for a bit.
Okay, yeah,
Oh
just
my
kind of
God.
walk it off,
Yeah.
right? God
Recover
bless.
this time.
Holly, what about you? Any crazy stories from the clinic?
I'm not sure I can beat that one and still be appropriate. I don't think I can be appropriate. I don't know if we have HIPAA laws, but
That's all right.
Yeah. So I can tell you heartwarming stories.
Okay.
Yeah, do it.
Okay.
All right. So when I started at CurbVet, it was back in 2019, and then COVID hit. So we had curbside. I was fairly new there, so we had a new client that came in, just adopted a dog from the shelter. Dog was petrified. Obviously, the owner couldn't come in the clinic, so we spent time walking around the parking lot. And finally, the dog came with me, cowered in the room in the corner for
That's
10
my
minutes.
baby.
So I had to do something. So I just laid on the floor.
Mhm.
Dog inched over, finally laid down next to me, and we were able to do all the things. Not too long after that, the client actually moved to Alabama, brought the dog by to say bye. So I still have the picture on my phone. I still keep in contact with that owner. So once a year on the anniversary date of that picture, we text or call just to see how she's
I
doing.
love that.
So, yeah.
That's so cool because you do have that bond.
Maddie, if you're watching.
Oh, very
Yeah.
sweet. So that's
Yeah.
really cool because you have that bond with all of your patients and they all have all these quirky little stories, which are amazing. So guys, how's the team over at CareVet? I know you're building it and I know that, this is an exciting upcoming few weeks, but what can we expect when we enter the door?
I would say, we are building a great team right now. Everybody is on board. Everybody's excited about all the upcoming things. So I would say excitement. You're always going to get, hi, how you doing?
You really do.
Yeah.
You get like, I care when I enter that room. I mean, I'm greeted with Denise, amazing lady, very, very super sweet, who has years of experience and just a kind heart. It's so hard to find compassion, especially in a time of duress. You just never know what you're going to get. And I love the flow and the setup. Some dogs are very nervous about entering that space, but finding a spot where they're comfortable, getting them into a secluded room, might, calm them a little bit. I think it's really important too, because a lot of times you go into some places that are just overrun with so many patients. You're just a number and it's a lot of chaos, right? Is that what
Right.
you guys try to mitigate in situations like that?
Definitely, I'd say yes.
We do. I mean, again, we go back to we have the flexibility and the time to be able to commit. I would say one of the things that we do really well is manage those pets that are petrified,
Mm-hmm.
that are maybe considered a little bit challenging, that have been kicked out of other vet clinics because they can't be handled. I think our team, a couple months ago, we had sat down, we had some new team members, and we wanted to talk about what our vision was. And so I gave everybody a piece of paper and I said, write kind of your top 3 of what you want from the practice. And the thing that was number 1 for everybody, without ever discussing it, which told me we had the right team, was client relationships.
Yeah.
Yeah.
Right. Those relationships were most important to everybody inherently. accountability.
Mhm.
And I really think that is what makes our team
Mhm.
very strong.
Yeah.
And the fact that they enjoy that and they want that so much, and we can offer that in our practice, makes it so that people enjoy coming to work every day. And if people can see that, like our internist that comes to the clinic, she's an incredible baker. This woman's a brilliant. She's a genius. She's
her
brilliant.
brownies
We
are
love
amazing.
her. Her brownies
Yes.
are amazing.
Was that the lady that I met? Was that the tall lady that was in?
Yes.
She's amazing.
Yes.
Wow. Yes.
Dr.
Fabulous.
Wall,
Yes.
shout out Dr. Walls with Moves. So she brought in brownies, and she'd only made one batch that day.
Yes.
And she goes, I decided I'm giving these to you guys because you're the clinic that I walk in and everybody's happy.
Oh, that's so
She
awesome.
reminded me of a young Linda Evangelista.
Oh,
Like
yes.
stoic, pulled together, face is gorgeous, skin was
Oh.
glowing. She was like, "Don't worry about a thing. We'll be fine with that hematoma." Like bada bing, bada boom,
love it.
and she was like, "Poof, gone." And like she was probably going to the next
Now-
clinic.
Have you guys ever had, I'm just wondering if it's like, have you ever had any clients where you're like, your dog and cat, your animal can stay, but you cannot come in here?
Oh, interesting question.
Because
Because they're adding anxiety or something, right?
Oh, you
Or
mean
they're
in
just
terms of, like,
crazy.
in the room.
Like in general, like a crazy parent of an animal that you're like, no, your dog can stay or your cat, but you can't come in here.
There are definitely instances where we recognize that the pet parent is probably causing a bit of the angst.
Okay.
And usually, I can't say things that way. I have to say things like, I think that this
You're
might
making your
actually go
dog
better
crazy.
if I take your pet away from you. Are you okay with that?
Yeah.
Okay.
And usually they are. And I'm not always right. There are times we take them away and it's worse, and we go back to the room and we talk about a different approach. But most of the time, those are our babies. I'm the same way with my pets, right? Like I actually take my pets to my colleague because I'm very different as a pet parent than I am as somebody else's pet doctor.
Right.
And that emotionality, your pet can sense all of those things. So we just say to those clients, okay, we think this might go better without you here. And oftentimes it's taking the pet away. Sometimes it's having them step out of the room.
Mhm.
But we try to make sure that our clients are partnered with us in those decisions so that they feel comfortable with the approach that we're taking.
You know what else I think is funny about going to the vet? So when you go in the room with your dog, they knock on the other side of the door and it's like, what, my dog came in here naked. You could
We
come
do
in.
not-
So
we do
funny
not
to me.
do that.
It's like,
We do
you're
not knock
knocking.
on the
My
door.
dog has been
I
naked since she came in.
Doc knocks on the door. I do not, for one reason.
It's
I
so
had
funny.
a client many years ago that I knocked on the door and the dog went bonkers.
That's my dog.
Okay.
They're
And it was
one of
like-
them's highly reactive.
And we lost it at that point. Like the dog was
Gone.
out of control, and because of that knock on the door, so I no longer knock on the door. Hit or miss with Doc.
Hit
I'd
or
say.
miss. It's not so much that the pets are naked. It's more that it's funny because people will come in and suddenly the exam room is their office. Right?
Yeah.
They're on the phone. They're having private conversations. So I usually just do like a light,
Yeah.
like,
Yeah.
just in case.
I'm entering the door. So let's talk about preventative care plans and why is it so important to stay on top of your pet's health as opposed to waiting until something egregious happens?
I think again, old adage applies here. An ounce of prevention is worth a pound of cure.
And $1,000 in your wallet.
I say all the time to my team, whether it's related to veterinary medicine or life, you're going to pay one way or another. You're going to pay on the front end, you're going to pay on the back end. But usually the front end is a heck of a lot cheaper.
Yeah.
Right?
Yeah.
So from a cost perspective, which is on the forefront of everybody's mind these days, but also in terms of the quality of care, right? Pets are incredibly stoic.
Mm-hmm.
Cannot tell you the number of times people will say to me, but they don't seem like they're in pain. Animals are far more stoic than we are, right? We're kind of babies about pain.
Right,
They're very tough. So they don't often tell us that something is wrong until something is really wrong.
Yeah.
So by screening preemptively and doing preventive care and preventive monitoring, we can pick up on these things sooner.
Mhm.
We can intervene sooner. Oftentimes you'll have a better prognosis, better outcome the sooner you intervene, or the preventive care prevents those things from happening in the first place.
True. Yeah. It just makes their lives easier, honestly, because they won't tell you, like you just said, they won't tell you. They want to be okay for you always.
Right.
You know, there's nothing more than a dog's love or a cat's love. I mean, it's amazing. And they are our therapy, our war buddies. They're everything to us. And they want to be that so they don't want it to be an inconvenience. So I know, I think it's really, really important. You guys have some wellness plans too. Holly, why do you think that that's also important for people to really dive into?
I like the wellness plan because you pay upfront or monthly, and it includes all your core vaccines:
Cool.
rabies, distemper, bordetella, lepto, annual blood work,
All the things.
all the things. It also gives you discounts on yearly prevention.
Great.
Also
Dental?
gives you discounts on surgical procedures, dentals, spay, neuter, and those discounts add up. Again, nothing is cheap these days.
And there's
so.
nothing like seeing that discount active on your invoice because you're like, okay,
It's a stretched out.
I knew
love
that I knew that this investment was going to help me.
Right.
If God forbid, if something does happen, it really truly was a lifesaver in a lot of situations where people
Yes.
go through. I love that. So if somebody's on the fence about signing up or coming over to CareVet, how would you get them in through the door?
Apparently they have brownies. So
Yeah, okay.
There's
Yeah.
that.
We will share goodies.
People move for snacks. Yes.
I mean, aside from the things that we've already talked about, right? Being community centric, quality of care, those sorts of things. In terms of cost, we shout out to Brianna Harvey, headquarters. She's amazing. She is a big part of what got those wellness plans implemented.
Awesome.
And we also work closely with her and other members of the team to customize the promos or the plans that we can offer to clients, right? So clients come in, they give us feedback, they tell us what's important to them, they tell us, in what ways can we make it easier for you to access this care? And we're able to go back to the larger organization and say, hey, this is how we can customize and create a bespoke experience for our clients. So I think the fact that we can hear, like we can listen to our clients and then go back and implement. So I think we actually have a call with Brianna tomorrow.
Yes.
Because the wellness plans, the way they're currently set up, is it's all wellness services. Like Holly said, it's a discount on some services. But we've talked about how maybe incorporating dentals, right? Dental's pretty expensive.
Yes.
Anesthesia's expensive.
Yes.
Right? Cost of goods are crazy right now. So how do we make that more accessible to our clients? We want to make sure that they understand there is a spectrum of care. We want to be able to offer that spectrum to them, make it affordable and make it accessible, and customize that approach for them. So the wellness plans, I would say the $1 a day wellness plans, great way to start getting that access, provide that preventive care. We also currently have $1 feline exams.
Oh.
I think. Yep. So if you spend $50, let's say you come for vaccines or prevention, it's a $1 exam for cats.
It's amazing.
We have the $25 off new client exam.
Okay.
That's awesome.
And if you refer a new client, you're already a client, you get $25.
Okay.
There you go, Sonny's right there. I mean, Mel and I are always going to be recommending the
Yes.
latest and greatest.
Wait, I have another question.
Sure.
So, with being a vet and living in like neighborhoods around town, do your neighbors see you and they're like, "Oh, my dog is limping, my cat is this"?
Oh yeah,
Do they
you get
ask you like
attacked
all
at
the time?
Publix. Yeah.
Yes, I do get accosted at Publix. I don't.
Do you give them
mind,
an
y'all.
invoice? You're like, "That's $50."
No, I say call the office.
Yeah.
I am not the doctor. Typically, I will tell them contact the office. Like, we'll get you in right
Yeah.
away. As far as can they have rotisserie chicken? No, the answer is no.
Yeah, no, it's too fatty. It's not good.
But, for the most part, I will say if they're injured or sick, call the office.
Yeah.
Yeah.
Basic
Or
stuff.
text. I love
Or
the text
text.
feature
Yes,
too.
we can text. So you can text the phone number to the clinic and
Yep.
we can respond. And we typically respond faster that way.
All right, this 2-part question. First part, what's your favorite part about being a vet and what is your least favorite part? Tricky.
Answer to both.
Yeah.
The people.
Yeah.
The people are the best part.
And the worst part, it's like
and the hardest
coaching.
part.
Yeah.
I would agree with that.
I would say one of your strengths is your realness, both of you, really, truly. Because I know that I can ask my silly questions and I know I'm going to get a great answer. and I don't feel insecure about my pet's health, because it is something that I take even far beyond my own health. My pets will come first. It's just the way it's going to be in my life. But I've got to commend you and the team of just making me feel welcome in a time that I didn't know if we were going to lose her
Scary.
ear. I didn't know. It was very scary because we saw cartilage. I mean, it was crazy. But we held it together. We were there on the table. I was a part of the team in that
Yes,
moment.
yes, you were.
And it was such a beautiful way for me to understand your practice. And I've been a CareBet patient for years, but this elevated my experience because of your team and how gracious they are on my time. It was beautiful. So I do want to commend you guys. You are absolutely an extraordinary veterinary practice. And it doesn't matter the Google reviews and the spotlight, or
Yeah.
you need this and that. You are the real deal. And that is so beautiful in our town. Thank you.
Thank you.
Yeah. You
Do
guys,
you guys make house calls?
yeah.
It's on the list of
Not yet.
things we would like to be able to.
Okay.
Cool,
Okay.
yeah.
As we grow and develop, and
We have some beautiful Sunnies out there that are very vocal about their agoraphobia and leaving the house, but their pets are part of their therapy. So that would be giving somebody a freedom that they can't give themselves, and that would be an amazing addition. So yeah, once we figure that out, but yeah, that's great, and there's a future of growth there too, which is
Yes.
awesome. Ladies, thank you so much for your time today.
Thank you for having us.
Incredible
so
conversation. More conversations to come on Sunny
Yes.
TV. We got to have you back in the studio. Folks, we're going to take a quick break with Maritime Creative and Flashes and Brilliance.